kept in the loop every step of the way, and that I really appreciate, because then I've also got coaches' email contact information in case I need to have direct communication with that person. That piece of it is smooth as silk, and I so appreciate that. The knowledge that lifestyle medicine is just so impactful. We don't want to just be handing out prescriptions for medications to people. We really understand the importance of stress reduction, quality sleep, moving your body, nutrition, and all of the coaches at Terra coach on lifestyle medicine. That was one thing that made me feel really good, was knowing that when I referred my patient off, no matter which coach they chose, that they're all going to be focusing on those various elements and making sure that we weren't ignoring one really important piece of their overall health. All of the coaches each have their own little niche, but there is so many choices in terms of gender or ethnic background to your coaches, the language that they speak, maybe they have like a particular niche in something. I love the fact that some of them are registered dietitians. That's been fabulous. So there's something for everyone, in my opinion. And I like the fact that I don't have to hire my own dietitian or my own health coach in my practice. I got this at my fingertips, and it's a large umbrella. It started off sort of small, and initially, I think when I first met John and he sort of told me about Terra and what he had started, I began referring patients, health coaching, but once I made that referral, the ball was in their court. Like, they had to, connect with you, and then they had to pay independently. And for some reason, I wasn't getting as much traction. And then probably about a year and a half ago, when John started the combined therapy program, where you have the weight loss medication plus the coaching sort of all in one kind of package, that's when things really started to take off. Because I had a bunch of patients who were thinking about GLP-1 medications or other FDA-approved medications. And myself, having been trained in obesity medicine, I really felt strongly that there needed to be the lifestyle support and component. You couldn't just do the medication alone. And I wasn't really sure how it was going to fly. It was sort of like an experimental program, and we put it together, and I put it out there to my patients, and one by one we started enrolling patients, and now it's got momentum. I mean, I have a couple of patients who've already graduated from the program. It was a year-long program, and they had such success that now it's very easy for me to tell new interested patients about it and, what the collective experience has been. And, that I think really helps, and now it's just become sort of a well-oiled machine, and people are definitely willing to pay for it. I think we've really tried to keep the prices as low as possible, to make it so that it's not extraordinarily, ridiculously expensive for them. And, on my end, we wind up going through the hoops of trying to get their insurance to pay for it. So we do the prior authorizations. But overall, that's gone pretty smoothly. And so they don't have to pay out of pocket for their medication. They're just paying for the coaching and I think for them also having that skin in the game really helps them to follow through it. Referral standpoint, like once the decision is made that the patient wants to participate in the program, that piece is very easy. Like, we've set it up just like if I was going to refer to any other specialist. I have Tara's fax number sort of programmed into my EHR, and then I just send off a letter, like similar to a referral letter that just says, like, I'm referring this patient, and it's for and I'll tell them whether it's the combined medication and coaching program, or if it's just for coaching. And then I'll also put in there, like, which coach we think would be the best fit for the patient, and then I just write on there how we're going to bill the patient. So either Tara can bill the patient directly, or we can create a combined program where Tara bills me for the program for the patient, and I just charge the patient. So that part is super easy, and I feel like that has made it just like smooth as butter. I mean, once I make that referral, as you know, Cecilia, you then reach out to the patient via email, and you also have me included on that email so that I know that that patient has been contacted. And then also I get a second email once you and the patient have decided on which coach it's going to be. So I'm kept in the loop every step of the way, and that I really appreciate, because then I've also got coaches' email contact information in case I need to have direct communication with that person. That piece of it is smooth as silk, and I so appreciate that. As far as the other pieces, there's different ways that patients will come to me. Some of them are starting off completely unaware of the coaching options, and they might just come with me because they're frustrated and they're trying to lose weight and they don't know what to do, and we're sort of starting from scratch, and I'm introducing the idea of health coaching to them. Others are coming to me and they already know that I've got a program that involves coaching and medication, and they're sort of like set and ready to go. So it depends on the entry point, but usually we'll be sitting down and I'll have like an hour-long session where I'm doing a lot of intake. I'm talking to them about their goals. We're talking about the coaching process. I tell them a little bit about the program. And we talk about the coach's choices. And this sort of speaks to one of the things that you had put on the list that you wanted to ask about, which is, what are some of the things that I really like? It's the variety of coaches that they get to choose from. I often tell them like, hey, Tara has like, I don't know how many coaches you have. It might be like 25 or 30. And I say there's a good fit for everyone. You get to choose your coach. And I'll often kind of steer them towards my starting lineup, which we have about 5 coaches that I work with the most. And I can tell them a little bit about their strengths and personality. And I really stress to the patient, like, you get to choose. I think they really love that. They want to know that they're going to have a good fit. So that's sort of the process for referring a patient. And once you do it once, then it just starts to become very, very easy to repeat again and again. Will say to me, I know what I should be doing. I'm just not doing it. And that's a wonderful segue for me to say, that's why health coaching is helpful, because it's a person that's there that keeps you accountable, because knowledge doesn't equal habit change. And I think a lot of us know what we should be doing. We're just not doing it. And having that appointment on your calendar once a week is often enough to really keep you moving along and keep your goals at the forefront of your mind. And so we talk about the power of that. I think that's helpful for people because, you get all comers. You get people who might be very knowledgeable about nutrition or, have had many different experiences with Weight Watchers or working with, a trainer. Who knows what they've done in the past. And they may feel like, I've already got all this knowledge, but they're just unable to put it into action. So that's where I feel like this is a wonderful way for me to support them. And also the proof is in the pudding. I'm able to speak to the fact that, like, right, here's my patients that have already done the program and this has been their experience so far. So I think that also hits a little bit close to home. But I would say there aren't that many questions. I mean, sometimes people might ask, can I switch coaches? And you just, addressed that. Sometimes people ask, what happens if something comes up and I can't complete the year? So we talk a little bit about that. We talk about this is a commitment up front, and we're hoping to at least get a commitment of about 6 months, but it's a year-long program. So I kind of prep them for that. We really haven't had any issues with that so far. The wonderful thing that I have found in DPC, and I think a lot of direct primary care practices have the knowledge that lifestyle medicine is just so impactful. We don't want to just be handing out prescriptions for medications to people. We really understand the importance of stress reduction, quality sleep, moving your body, nutrition, and all of the coaches at Terra coach on lifestyle medicine. That was one thing that made me feel really good, was knowing that when I referred my patient off, no matter which coach they chose, that they're all going to be focusing on those various elements and making sure that we weren't ignoring one really important piece of their overall health. And so I think that's really something universally important to family doctors and primary care doctors. I think we really understand that that's important, but sometimes we just don't have the time. Even in DPC, we may not have the time to really sit down on a regular basis and go over that. So having a coach that's meeting with the patient weekly and every other week and touching on each of those things is just so invaluable. So that's important. All of the coaches each have their own little niche, but there is so many choices in terms of gender or ethnic background to your coaches, the language that they speak. Maybe they have like a particular niche in something. I love the fact that some of them are registered dietitians. That's been fabulous. So there's something for everyone, in my opinion. And I like the fact that I don't have to hire my own dietitian or my own health coach in my practice. I got this at my fingertips, and it's a large umbrella. So that is wonderful. The other thing that I absolutely love, I will point this one thing out, and it's happened a couple of times in my patients that have been doing this program. There have been times when we've bumped up against a problem where the patient could really use some advice from a registered dietitian. And maybe their coach that they've selected doesn't have that as part of their credentialing. But we've been able to ask, say, Laura on the team, who is a registered dietitian, to do a one-time consultation and help the patient with like real nitty-gritty, helpful and structured advice on like, how much protein should they be aiming for and when should they be aiming for it, and how can we reduce some of the side effects from the GLP-1 medicine that they're on. And that's been so great, because there's been times when I've had patients come and they're like, I don't know, they're losing almost like too much weight too fast, or I can tell they're not getting enough calories in because the medicine's really creating some side effects. And having that depth of knowledge base and ability to tap into other members of the team as needed has been just a game changer. So that's another little favorite aspect that I've had. One of the things that I think really helped to like hook me in right from the get-go was just hopping on a Zoom call and, speaking with John personally, and then speaking with you, like forming that relationship with you guys really made it so much easier, because I had a face with a name, and it made it like I knew who I was sending my patients to, and they were in good hands. And I always tell the patient, like, you're going to get a contact from Cecilia. She's like a liaison. She's going to hook you up. And I kind of like talk it up and tell them what to expect. And so that too sort of paves the way for them. But, for a new person, a new doctor that's considering, I think having that one-on-one phone call or video call I think it really probably helps to seal the.
Yeah, absolutely. You want to trust who you're sending your patients to.
Yeah, exactly.
That is definitely something that's important to us. For us to understand too, to build that relationship of knowing what your needs are as a provider, who you're seeing, and where the gaps are, so that we can help really accommodate that. But that trust is really important, and that's why we're keeping you in the loop every single month. If you send us someone and they sign up, we want you to be kept in the loop so that when you see a patient again, you have an update on a monthly basis on what's happened since they last came to your office, or since you last spoke with them. Because how many providers, refer out and then you never hear back again. You want to be able to trust the service that you're sending your patients to, because there's that responsibility there.
Absolutely. And I completely forgot to even bring that up, but I really appreciate the communication. I love getting those, monthly notes with just, it's a few paragraphs, but it reminds me like, okay, great. The patient's engaged. They're, this is what they're working on. And that's important, that feedback loop. So that is,
even if it isn't something, because also the coaches write up and changes that they're experiencing. It could be with their medication or something. Those are really important, of course, but it could just be the little things like they've really worked on stress this month and they've noticed a difference in their sleep, and all of that is really important. So those updates are actually probably one of the most important parts of the program that keeps the DPC looped in on what's happening. Mm-hmm. That they're not just disappearing into the abyss and they'll go work with a coach and see you in 3 months. Like you're being kept in the loop.